Hello, children. How are you? I hope you all are doing good. I'm really enjoying going through this blog, and I hope you are also enjoying too. Please let me know how you all are doing, if there is any problem. I have seen many of your assignments and all very good, really good. Keep it up. You all are doing great work. And still, if there is any problem, doubt, please let me know. So, in our block 15, we have done two lessons. First one, we have seen how the formation of state government. Secondly, we have seen the role of an MLA. Today, we are going to do the third lesson, which is public and private healthcare. So let's dig into the lesson, and I welcome all of you in today's lesson. So let's start. Let's do the review first. In our first class from this block, we studied about how the government is formed in a state, and also we were able to infer or differentiate between how the state government is formed in India based on election results. We also learned about the functions of legislature, executive, and judiciary. And in our last lesson, we have learn and examine the role and functions of the member of legislative assembly, in short MLA, in the functioning of the state government. Let's see our today's learning objectives and our lesson goal. In today's lesson, we are going to learn to identify that despite the state government's efforts, access to healthcare is determined by economic status. Now, this is a very serious and important one. Government must provide us all equal healthcare system, but we learn and see that it is totally different. The people with good economic status, in short, the rich people, get the better healthcare than the ones who are unable to pay. But still, government is working on it, and we hope it will improve. But today we'll see the differences, major differences in between both public and private healthcare. Let me ask you a question. What do you think of the word health? I know there are many things with which you can relate health with. Few of them are clean drinking water. When there is clean drinking water, clean air, healthy food, of course, you will be healthy, happy, you will be disease free. And that's what is health, isn't it? Free from disease and uh, sleep, proper sleep, and peace of mind, na sound mind. That's what is known as health. And this can be achieved only through clean drinking water, clean air, healthy food, good doctors and hospitals, and many of our good activities. These are all determines our good health. But above all, if there is any problem, then we need good doctors and hospitals to treat us. And this is one of the main duty of the state government, to make sure that people have access to quality healthcare, to prevent and cure diseases. But sad to say, in India, opportunities and access to healthcare vary in our country. As I told you, rich always get the better treatment, better hospitals, and this happens in every state, almost in every state of India. But we hope and pray that it will change, and it is also important for us to learn so that we'll know where and what lacks and how can be made better. Now, what is healthcare? In your book also definition is given of healthcare simply, but here I'll explain to you just in simple word. What does the word healthcare means? Healthcare means it's related to medical services. Health care. Health care. That means health means our own health, and care means somewhere it can be taken care of. So it means medical services. Now simple word, if you put this healthcare, that means our health taken care of. Now this one done in somewhere facility, at least an hospital. It's a facility. So in the it's an adjective phrase, that's healthcare facility, which simply means a place where that provides medical care. So that means healthcare facility, and healthcare means providing medical services to us in our health. That is health care. Definition is given in your content book. You can go through them. Now, the difference between public and private healthcare. With the difference only, we'll understand what is a public healthcare and what is a private healthcare. So, for public healthcare, the first is run and funded by the government. If it is run and funded by the government, government takes all the decision, then it is a public healthcare. Government hospital. Private healthcare, run and funded by one person or a group of people. A doctor who started his own hospital, or some group of doctors started their own hospital. This is called private hospital. Like any hospital, where you have to go and pay high prices for everything. You have to pay prices for everything. There is nothing called free. That is private healthcare. Secondly, public healthcare includes in rural also, urban also. If you go to villages or in town, you will see government hospitals are there in both the places. But in private healthcare, hospitals are largely found in urban areas. I think you have noticed this one also. In town, we see many private hospitals, nursing homes, doctors, big hospitals. But when you go to villages, how many private hospitals you see? Big one. You will find none. You may find one or two doctors who are running their uh, clinic, but will not find much of the big hospitals. Thirdly, public healthcare cost of treatment is very low or sometimes totally free. But in private healthcare, cost of treatment is very high and never free, and we have to pay a big price for it. Private hospital, of course, you know it's cost us so much. So I hope with this you have understood healthcare, you have understood public and private healthcare differences, and with the differences you have understood what is a public healthcare and what is a private healthcare. Now a case study is given in your book to know the more differences of them. In this case study, there are two friends, Samita and Salma. Samita was asking Salma, why didn't you come to the school picnic? Now, for that, Samita replied, oh, I had a fever last week and my mother took me to the new private hospital. It did not look like a hospital at all. It was more like big hotel. The doctor did a number of tests and gave me many medicines all in one day. It cost us 2000 rupees. Did you go to the same hospital, Samita? So Salma was having fever, like how Samita was having fever, for which she missed the school picnic. So Salma also replied to Samita, oh, I also had fever a few weeks back. But Salma went to a private healthcare, private hospital, and it was very big. It was looked like a hotel. It cost them 2000 rupees, and everything was done in one day. And they came home with the reports and medicine and all. But Samita, she did not go to the public healthcare. Samita said, no, Salma, I did not go to the new hospital. My father said it too expensive. He took me to the government hospital. We had to stand in a long queue to get one blood test done. I had to go back after 2 days to collect my blood report and get my medicine from the doctor. Can you see the difference between Salma and Samita's cases? Salma gave 2000 rupees, did the test that day only, got the report that day only, got the medicine, and came back home. In Samita's case, she went to the government hospital. She had done the test that day, but the report was given 2 days afterwards. Then she got the medicine. So see the difference. Now there is a difference in amount also. 2000 for curing a fever, Samita is saying. My father only spent 200. That is also for medicine. Why there is such a big difference in the cost of treating the same illness? I wonder it was because of the hospital. Salma also had fever. Samita also had fever. Salma spent 2000 rupees. Samita spent only 200 for medicine. And now they are thinking why there is difference. And they are saying there by themselves also it is because of the hospital. Now see what a big difference between the two. And you also know such big amounts are not possible for the poor people. That's why healthcare government should, it is very important duty for them to provide the healthcare for in affordable price to everyone. Next, what we have seen in the case study, out of this what we clearly understand is that private hospitals charge more for their services than government hospital. And a government hospital is run by government and its services are cheaper than the private hospitals, which are run by one person or group. Private hospitals are run by one person or group. Though private hospitals may have better medical facilities, not everyone can afford the high cost. As I have told you before, private hospitals provide us better medical facilities, but everyone cannot afford. Many people choose to go to government hospitals because their services cost low. True. Those who are poor, those who can't afford, they have to go to the government hospitals, which cost less. But we all know that better medical facilities are available in the private hospitals. Now let us go to the next one. Here, this is a picture which I have collected from the internet. It is like public versus private healthcare, but the here something is given is that why people are choosing private healthcare. We already know, we have already studied. So, but still, I want to give you a last another explanation, a little bit why people are choosing private healthcare. The first is public healthcare problems. Public healthcare problem means when you go to government hospital, you will see it's in jeopardy. You will see that the condition is very bad, and you will see that proper doctors are not there, proper infrastructure are not there, and so many lacking. That is the first reason why people go to private hospitals. Second one is expenditure diversification. Preventive and primary healthcare marginalized. It is very very marginalized. If you go, the expenditure is done, but not done in such a way that it can like give us everything. Focus is shifted from more to small matters, vaccinations and small things, and higher importance is not given to clinical importance. Like if you go to private hospitals, they will do so many tests, so many things, but in government hospitals many things are not given taken care. And this way we find that private hospitals are more appealing. Third is numerical facts. There are some numerical facts, and the numerical facts clearly show that people prefer private hospitals. People want to go there. People know that it is better. People know they will get better facilities. So 70% of the urban population go to the private hospital than to public healthcare. So that is a big thing, and that's where the problem comes. Many people go to the private because that is also the reason is there. Public hospitals are unable to give us the treatment that we need or the care that we need. And further steps, number 4 is further steps. Government hospitals need to work together, various organizations need to come, and they need to play major role. And improvement in healthcare and technology plays a crucial role in facility. Much more changes are needed, much more activities are needed, and once private public hospitals are getting better, government hospitals better, people will do go back. And let me tell you this, every government hospitals are not bad. If you go to some interior villages also or main towns, there are some government hospitals which are very good thanks to the government. There are some, okay, it's not that every all the government hospitals are bad. Now there is two example. First one is district hospital. This is government hospital of Dimapur, district hospital of Dimapur, and second one is Eden Hospital of Dimapur. I think both of you know both of them. I don't know how many of you visited this district hospital. This is the new building, so it looks good. If you have seen the old building, you must have seen, but this is the new building. But still, when you visit, you'll see how the treatment and how people are treated. And Odeon Hospital, I think most of you have visited. These are the new facilities, very good. So with this an example, the difference between public and private. Conclusion. Let us conclude our lesson today. India has a vast healthcare system, but there remain many differences in quality between rural and urban areas, as well as between public and private healthcare. Healthcare between states and rural and urban areas is vastly different. Rural areas often suffer from physician shortages, and disparities between states mean that residents of poorest states like Bihar often have less access to educate healthcare than residents of relatively more affluent states. These are the conclusion we have received from our lesson reading. Assignments and announcements. Please read the section. There was this one of the mistake in the section, but read the section public and private healthcare from the content book page number 2021 and complete your workbook S3. Complete PQ question number 8 in your notebook and log into the Google Classroom and complete your assignment given there. In case of doubt, please feel free to contact me. Tomorrow is our Google Meet. Please get ready. We will be discussing all these three lessons which we have covered, and we'll discuss problems from there. Lastly, Thank you. Stay home, stay safe, take care.